Hi, I'm Dr. Baird with V-Gentle Wellness and Aesthetics. The buzz of the day is semaglutide weight loss program. So semaglutide is a medication that was originally invented actually for diabetes. And the way it would help with diabetes is it would bring people's blood sugar into a stable level so that their blood sugar was maintained at a good level all the time. And with their blood sugar being normal, they didn't have cravings. Because when your blood sugar plummets down, then you have these food cravings like, I gotta have my chocolate and ice cream or whatever you want. Semaglutide works by just keeping that blood sugar at a nice stable level. It also works by slowing stomach emptying. Your stomach stays full longer and you don't feel as hungry. As an end result, people who took this medicine for their blood sugar and diabetes, they weren't eating as much. They felt full. They didn't want to eat as much. They didn't have cravings. And the average person taking the semaglutide for diabetes lost about 10% of their body weight in the first 3 months of taking the medicine. So think about that. If you weigh 200 pounds, 10% is 20 pounds. That's pretty impressive. And the weight loss continued the longer they were on the medication. The FDA recently approved semaglutide for weight loss, and they did studies where they just use it for weight loss in people that didn't have diabetes, and they likewise had a very similar result. The first month is a little bit slow as your body adjusts, but usually the second month it really escalates and takes off, and you lose a lot more weight the longer you're on that medication. So let's talk about the potential side effects with semaglutide. There's always side effects. There's pros and cons with everything. The most common side effect that people have is nausea. You think about it. If your food isn't emptying out of your stomach and it slows that process down, then you just feel full and sometimes you feel a little more nauseated. And that would happen with some people. Also, if you're slowing down your intestines and things moving out, guess what's going to happen? You're going to get backed up. So there's constipation is a common side effect. Now, most of the people that I've worked with have not had nausea or constipation, especially at the starting dose that first month. As you increase the dose and you get a little more aggressive, then some people have that nausea and that constipation. And if you do, there's ways to treat that. Certainly good fiber, lots of water. There's anti-nausea medicines. There's things we can do to help you with that nausea. But those are by and large the two most common side effects, and that's all we really hear about. Now, probably the scariest side effect is rare, but you got to know about it. If you've had any form of thyroid cancer, especially medullary thyroid cancer, or MEN2 is a technical term, semaglutide increases the risk of that cancer by 50% for people that are on the medication long term. So what does that mean? That doesn't mean that 50% of the people are going to get thyroid cancer. It means the risk is increased by 50%. So let's give you some real numbers. 15 people out of 100,000 people get thyroid cancer just in the general population. Now, if you increase that risk by 50%, 50% of 15 is about 7. So 22 people out of 100,000 people can get thyroid cancer if they're taking semaglutide. So it is a 50% increase in risk, but the end result is about 22 people out of 100,000 can get thyroid cancer. If you've had thyroid cancer in the past, you really should not take this medication. It would not be good, and it's actually a contraindication. All right, so how do you tell if semaglutide is really for you or not? It's pretty simple. If you carry extra weight and you want to lose weight, it's for you. Really, the risks are very minimal, and the results are incredibly beneficial. Not only can you lose weight quickly and you can jumpstart that success, there's nothing that feels better than just not lugging around all that extra weight. But to be able to maintain it is a huge benefit. So semaglutide is a great weight loss program. Come into our clinic and we'll teach you all about it and how to maintain that weight loss for long term so you can feel healthy the rest of your life.